I will be sharing with you my story, my experiences, and a lot more. And I wish that you all are going to be part of it. You enjoy the talk, you enjoy the presentation. And I also hope as well that it's going to be interactive. If you have your questions, I will be happy to welcome them. So that is it. In fact, I just want you guys to know that I'm very happy to be part of you this afternoon.
Thank you. Dr. Renita, I don't know if you have a word for our guest. Before we
Emmeline has been excited about having you share with us. So we thank you so much for joining us and for taking your time to share your expertise. Self-care is something that is too often neglected. We work on a lot of content and we work on a lot of strategies, and we often neglect to take care of ourselves, which means we can't achieve our strategies. So we are very thankful that you are willing to share with us and our team. And I know people will continue to join as you get started. And so again, we just appreciate your sharing what God has given you, and especially your heart for Africa, which is our heart as well. So thank you.
Thank you very much.
I also see Dr. Phil on the line. That's another one of our leaders, our board chair. I see Sister Quinta Moto has joined us from Omega Gospel. She's in Atlanta. God have mercy. She's somewhere in Texas, in the US. I keep forgetting her particular state, but I'll get there. Maybe when I actually visit, I'll remember it. I'm trying to see who else on the line that I haven't introduced. So, Dr. Phil, it seems you are frozen. I don't know if you want to start us out in prayers. That way we can go in with the introduction, and we have just 2 hours and she has a lot to download for us. So,
are you asking me to pray?
Yes.
All right, let's pray. Father, we do bless you and thank you for the miracle of communications across miles and across continents. Lord, thank you for our guest, and we speak a blessing upon her, that you would work in her and through her to communicate what you've given her to communicate to us. So open our eyes and our ears and our heart to be able to see and hear and feel what is on yours hearts today that Karen's given to us. So we commit our time to you and ask that in all of it, Jesus be high and lifted up. In his name we pray. Amen.
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 And it's my honor again to introduce to you my sister before she starts, Marceline. I've known her since I was how old? 12. And then I discovered she's actually, I met her in school, and then I discovered she's actually a cousin to my cousin on my father's side. So she's my sister in Africa, that's sister. And the day I got born again, I was actually in their house. I was sitting there when they came and shared the gospel to us. And by the grace of God, we were 3 of us, and all 3 of us are now children of God. She is presently in Germany with her family, and she'll be telling us her story and telling us her work on her journey, and how her health, or how our lives even are dependent on us taking care of our health. So without further ado, I'm going to hand over to her. I see she's already put on her screen, and I think she's going to move to slideshow, and I'll hand over the meeting to her. If you have any comments as she goes on, we know the rule, just put it in the comments section, and we'll be talking about that when she finishes her presentation, or when she gives us time to ask. So, Max, over to you.
Thank you very much, Dr. Emmeline. So nice to call you Dr. Emmeline. Thank you so much for having you. And I would like to start from my screen. Our topic of discussion today is manifesting God's calling from pain to purpose. And I will begin with a slideshow. Yeah. I don't know, is everybody seeing my screen?
Yes.
Yes, looks
Yes,
good.
I'm
Okay.
seeing your screen.
Okay, yeah. Yeah, so as I said, the topic of our talk for today is manifesting God's calling from pain to purpose. Emmeline has already introduced me, and I don't think I should be introducing myself any longer. So we'll move straight to the point of discussion. I would like to begin this presentation with a statement from Joy Austin. All of us experience pain. Don't just go through it. A minute, please. Yeah. Okay. All of us experience pain. Don't just go through it, grow through it. That pain is not there to stop you. It's there to prepare you, to increase you, to develop you. Eventually, the pain will pass and you will give birth to a new strength. This is a summary of me. So I would like you all that as I go through my talk, two things that I would like you people to get from me is information is optimal. Information is very important. The role of our church leaders is as well very important. What I mean by information is very important is that knowledge is power. If you are not informed, there are lots of things you are going to miss along the line as you live your life. There are just lots of things you're going to step over without you knowing. So, on the other hand, the role of church leaders, I would also like that as we get along this discussion, your take will be that as church leaders, as we pray and encourage our friends, our brothers, our sisters, on the other hand, while praying for them, we should also encourage them to do their part, to do their work. We should not only depend on prayers. I know prayer is the key to everything, but at the same time, while we pray, we should work. Pray without working will not help us. So, Emmeline already introduced me. I will not introduce myself as well. So my story is a story of challenges. It's a story of pain. It's a story of hurdles. It's a story of a very emotional one. But at the end of the day, what is important is how you are able to put yourself together and listen to the word, and then you move forward. So from our agenda as well, before I will get to my story when I go to the next slide, but I would just like you people to know that from my story, purpose from pain was born. And then we'll talk about what was the core of my issues, of my health problems. That's had to do with iron deficiency anemia. What is it that during my journey, when I was exercising my call, what is it that I discovered along the way? In addition to my pain, the iron deficiency anemia issue is hypertension. And then what is it that I did? I tried to act on what the Holy Spirit left in my heart. I tried to communicate with God. And on the other hand, what is it that I did towards our communication, and what was the assignment that was laid to me? How was I able to carry out my assignment? This assignment was carried out through outreaches. And as a result of my outreaches, what was the outcome? Testimonies was what we had as outcome. So when was the last time, this is an icebreaker, when was the last time you had a health checkup? Do you know your current status? For example, are you anemic? Are you hypertensive, etc.? You can drop your answers in the chat box as we continue. If your answer is, if you answered no to any of the above questions, which of the following is a factor to that? Is it fear? Is it religious beliefs? As to the best of my knowledge, I come from a culture, from a society where a lot of people are not able to open up, especially women. A lot of people cannot express themselves. And then we are also covered up in our religious beliefs. So some of these things, they hindered us to be able to be outspoken. And as I said, is it one of the reasons why you've not been able to go to checkups, you've not been able to do a lot of things? Is it because of fear? Is it because of your belief? You can still drop your answers. So in the beginning, I said my story is a story of pain and a story of challenges. Growing up as a young girl, as an adult, I was studying hard, and I actually looked forward to a great career, because we know that in life, you have to work hard in order to achieve your goals. You have to do a lot of things. You have to do what you love. So I aspired, looking forward for a great career, eventually marriage, and then having a family. But you know, they say we plan as man proposes, God disposes. That's the funny quotation we used to say before. So in this case, I usually ask myself if my plans were the plans that God had for me. Did I even include God in my plans when I was really growing up? So as part of my journey, my life was a life of fatigue. As I grew up while I was studying and I was hoping for other things, I was experiencing fatigue, experiencing headaches, lack of concentration, addiction to eating clay. And to my sisters from Africa, they understand what I mean by eating clay. There is a product that we call clay is white, and we usually eat it. So you eat without even knowing the effects that that is having on your health and that is having on you as a whole. So as I grew up, I was having all of these things. But to the best of my knowledge, I was really ignorant about all of this. And I was used to, my system became adapted to it. So for me, it was normal. I didn't think anything particular was wrong with me. Then after that, after studying my master's degree in public health in Umeå International School of Public Health in Sweden, I found my partner, and after we got married, our plans were, okay, you know, coming from an African family, when you are married, one of the first things they are expecting within the first 9 months or first year in marriage is having children. And the moment these children are not forthcoming, it's another issue, it's another problem. So as we were hoping and expecting, which all proved unsuccessful, with all the hopes shattered, because we were hoping that within the first 1 year, we'll be having the fruit of the womb and everything will be fine, but that didn't work. So 3.5 years had been years of pain, expectations failing, moving, and then I went into stress, having a lot of stress, pressure from family and friends. Depression came in. My life was full of unhappiness and anxiety, because one of the most important things we know, as I said before, from where I come from, is when you are married, you need to have children. So the funniest thing is that at one point in my life, I decided to take action for myself, because I had visited the hospital a number of times, and I kept being reassured by my gynecologist that, oh, everything is fine, everything is perfect. And I said, no, everything cannot be fine, everything cannot be perfect. If things are fine and perfect, then I should have been having a child right now. And this is not the case. So what is it? So I remember telling my gynecologist that, please, I know that in life, at one point, some people are not able to conceive because their tubes get blocked. Please, can you check if my tubes are blocked? So we all arranged and agreed that I'm going to take this procedure in the main hospital, so that in case of any emergencies, we have all the specialists on standby. So it happened that when I went to the hospital, the first thing that was done was a blood test. And when this blood test was done, I was ushered to my room, to my ward, to wait there. So I sat there and I was waiting from minutes to hours to, in fact, you can name it. I waited and nothing was forthcoming. This is a procedure that would have taken place since at about early hours in the morning, like 7 a.m. But at one point it was already 9:30 a.m. And the doctors were not yet there. And all of a sudden they came in and I was so excited and they attended to the first 2 patients. That's how my adrenaline was pumping hard. And I was like, okay, what is it that these people are going to tell me now? And then all of a sudden I just heard I was very anemic. My blood is not good. I'm like, come on. And then, you know, at that time I was really ignorant. And as I said from the beginning of my slide, information is really optimal. At this point, I had not really been informed about anemia, about iron deficiency anemia in particular. So hearing that I was anemic, the first thing that came to my mind as an African woman was like, no, I don't have HIV and AIDS. I'm not suffering from HIV. I'm fine, I'm pure, and all of those things. So, and I was told, no, what you are suffering from has nothing to do with HIV and AIDS. You're very anemic. Your value is 5. And I was told that I could look for a child for the next 100 years. I will not be able to conceive. And even if I was fortunate to conceive, I will be having miscarriages because I need enough red blood cells to be able to become pregnant. And then I was now with the hopes and everything I had coming for a procedure that was going to.
You see your sister? Really?
I remember that I was told that I was really anemic and I was like, okay, coming for a procedure to take place and then leaving now very disappointed. I was asked to go to my general practitioner so that he was going to put me on iron supplements. So when I went now to my general practitioner, and he went through the pages that was referred to him from the hospital, and he made this statement: many African women suffer from iron deficiency anemia, and the sad thing is that they are not even aware of it. And I was like, whoa, what do you mean? That was the first time I got to hear that a lot of African women suffer from iron deficiency anemia. And the sad thing about it is that they are not aware. And I'm like, okay, as disappointed as I was like, okay, so how do I move forward? Now I was asked to get iron tablets, which I took. And it was my treatment. These tablets gave me a lot of constipation. But to cut the whole story short, the long story short, I had a breakthrough when I started taking these iron supplements. And the problem first that I encountered was that with the constipation, I was asked to stop taking it. So I was now administered a liquid iron supplement, which is called Floradix. And after I took Floradix, just on the second bottle, I had my first breakthrough. And that was how my faith came in. Because during this time, I had actually been praying. I'd been doing a lot of things. I had scriptures that kept me going. So I had a first miscarriage. Then I had a second miscarriage. And the second miscarriage was a very painful one because it was already at 4 months old. Then I had to be induced and had to put to bed a dead fetus. That was really kind of traumatizing. And then the third miscarriage came on as well. The third miscarriage came. And that was when my life was actually turned upside down. And as I had said before, coming from a society where a woman's worth is determined by her ability to bear kids, this was really frustrating. So I had almost given up, but I remembered my husband standing beside me and supporting me. And as I mentioned, the scripture that kept me going was Isaiah chapter 41, verse 10. Do not be afraid, for I am with you. Don't be discouraged, for I'm your God. I beg your pardon, yeah. Don't be discouraged, for I am. Don't be discouraged, for I am your God. I will strengthen you and hold you up with my victorious right hand. That was really the scripture that kept me going. Finally, the long-awaiting breakthrough came when I finally became pregnant with my daughter. And it was a very successful pregnancy. And that was how, with the excitement, life fell in place. And then I had my son. I stopped breastfeeding my child at 6 months and then became pregnant again. So it was like having a baby on top of another baby. So, and after my son was 2 years old, that was when I started hearing, you know, during this time, I had been praying for breakthrough, praying for the spirit of discernment. And this is when God actually really spoke to me. I had been having visions, but I didn't take them seriously. I was like, no, this can't be. And in my visions, I will see myself speaking to crowds of people, helping women, helping children, speaking to a group of people. And I was really stubborn because with these visions and dreams, I didn't understand where they were coming from and what was it that the Holy Spirit was really ministering to me. I really didn't understand. And then I was really stubborn. But I remember that at one point I was like, it is time it is now time to give back. It is now time to give back. And when I remember that it was time for me to act on what I was hearing from God, I decided to take a leap of faith and act on the word. And that was how Health Improvement Initiative was found. Health Improvement Initiative is a non-profit organization that I founded. And I realized that through this organization, after discussing and sharing my story with a lot of women in church, friends, relatives, and other people, I just came to realize that I wasn't the only one suffering from iron deficiency anemia. And it was really true what the doctor told me, that a lot of women, a lot of African women in particular, suffer from that and they are not aware. So in Health Improvement Initiative, what we do is that our goal is that we try to impact lives, we make a difference in the life of other people. We create awareness through campaigns to talk about iron deficiency anemia. And as we started and things were falling in place, that was how blood pressure came in, high blood pressure came in, mental health issues, we started dealing with a lot of things. And then I realized during our journey that in Cameroon in particular, where I come from, and in my region, that's the northwest region of Cameroon, they don't even talk about blood pressure any longer. They call it collapse and die. And I remember during one of our sensitization campaigns, when I was being introduced, I realized the speaker saying, now you have to get enough information about collapse and die and things like that. And I was like, what is happening? What is collapse and die? And it was really, as I said, it was a new normal. It was normal for people to just collapse and die. And the thing is that when people collapse and die, and when they are taken to the hospital, before they even die, along the line, some people die, but after, there are some that die in the hospital. There are some that immediately they collapse, they pass. So what happened is that when they are diagnosed, they realize that a lot of them are suffering from high blood pressure, and they are not even aware of the fact that they have high blood pressure. So it was one of our goals to see how we could also change mindsets from people thinking that everything is normal, because from people collapsing and dying, our communities had their own interpretation for this collapse and die. It was not for them normal that people will collapse and die, especially if you had seen them a couple of days ago. So they had their own interpretation to that, which had to do with like, it's witchcraft. It's somebody who did it. This is somebody who was just so strong. What must have happened? And when it came to the miscarriages, for example, that I was going through, no, the thing is somebody must have done it. It could not have, it could not be normal thing. It could not be a normal thing that was happening, you know. So, and other people during our campaigns, when we talk, people only believe that, some people only believe that is when they go like to the church, and that is only when pastor lays hand on them that they are going to be fine. You know, they think that if it is witchcraft, it is only the pastor that can help them come out of it. So we were trying to change the mindset of our community, to tell them that not everything is explained through witchcraft. Not everything is explained through, people shouldn't think that collapsing and dying should be something that is normal, or that it is something that is explained through witchcraft as well. So how do we, as I said, how do we address this, our health challenges? And as I said also before, information is optimal, and it is not for, how do I put it? This particular scripture actually makes the case for us, actually justify what a lot of people think nowadays, that a lot of people perish due to lack of knowledge. I was perishing due to lack of knowledge, due to lack of information. I realized that my community as well was also perishing due to lack of information. Despite the fact that I have been in the Western world for a very long time, there are still things that I was ignorant about. And when I discovered these problems and sharing my problems and my experience with other people while in the Western world, while in the diaspora, I realized that there were also many people that were here, many brothers and sisters that were not as aware as I was thinking. They were still unaware like I was before. So as I said, it was really for sure that many people were perishing due to lack of knowledge. And I made sure I used this scripture to help my community, that we should empower ourselves with knowledge. We should empower ourselves with good information, not just any type of knowledge, good information, good knowledge. And we did this through our awareness campaigns. And during our awareness campaigns, as I said, our main area of focus was iron deficiency anemia on women, then blood pressure with everybody. So these campaigns were done. We also did workshops, and our workshops were also in Africa. We also organized workshops in Africa, just as we organized workshops here in Germany as well, to encourage, to empower women of reproductive age, because we also thought that the quality of life and well-being is something that was really important. So we made sure we educate these people about risk factors, the causes of iron deficiency anemia and blood pressure. We talked about risk factors, the symptoms, prevention, complications, how to seek medical help. Now, we didn't go into details to be giving people in our communities information that they will not be able to understand. So we made sure that we gave them the basics, what we thought was really important. And by the time they are now face to face with their doctors, while they were diagnosed with whatever problems that they have, the doctors were in a better position, the specialists were in a better position to explain in details what their problems were. It's true that during our campaigns, we work with medical doctors as well. But when you are diagnosed with the problems that we're talking about, you need follow-up. And when you do that, you need doctors that will do that, because we do it and then we leave. And then you need to stay behind and then have people who are doing the follow-up or the checks for you. Now, so what are the basic health information to be aware of? And as I said, our area of interest is IDA, iron deficiency anemia, and blood pressure. And as I said, I was dealing with a silent killer. I call iron deficiency anemia a silent killer, because when I had all those, going through the fatigues and the lack of concentration and everything, I actually didn't know what all of those things were. So for me, headache, okay, I will just run over the counter and I get a paracetamol or a ibuprofen at that time, and then I take it, and at times the thing subsides, at times it doesn't. It was not solving my problem. I wasn't getting healed, and I still didn't know what all of these were, but I thought it was normal. So What is anemia? Anemia is a condition in which blood lacks adequate healthy red blood cells. I mean, iron deficiency anemia is a condition in which you lack iron, sufficient iron in the body. People of all ages can be affected. People of all races and people of all ethnicities can be affected. So who are those at risk and why? People at risk include a menstruating female. I decided to term it a menstruating female because not all women menstruate. So a menstruating female. And why is it that women menstruating are at risk? There are women who have heavy flows, just as there are women who have normal flows. And the thing is, the tendency is that when you lose blood every month, like women lose, like women menstruate every month, during this time, they lose iron. And it is but normal that as you lose iron, you should replace the iron that you are losing. Because when you keep losing iron, at one point, you are going to have some health effects, and we will discuss that in our subsequent slides. So blood donors are also people who are at risk. As you keep giving blood, at one point, you have blood shortage if you are not taking iron as well. Not everybody gives blood. If you are anemic, it means your blood is not even good enough to donate. So people who are frequent blood donors are at risk of iron deficiency. People who are also vegetarians are at risk of being anemic. And people who are vegetarians, most of us know people who don't eat meat and other things. Infants and children are also at risk. Children who suffer low birth weight or children who are born prematurely. Iron deficiency anemia can be mild, and other anemia, because we have different types of anemia, iron deficiency anemia is just one of them. It can be mild, some can be mild. There are other anemias that are life-threatening. We will come to realize that iron deficiency anemia, if you don't treat it, it can become aggressive and it can become life-threatening. It was my case at one point. I will talk about it in the subsequent slides. So another type of anemia that I'm just mentioning it so that we know that it is not only anemia, it's not only iron deficiency anemia that can be life-threatening. We also have another anemia like hemolytic anemia, which is when your body can't produce red blood cells to replace the ones that die. And as I said, red blood cells are very, very important for the body. They transfer oxygen to your brain. I had mentioned before that iron deficiency anemia was life-threatening for me because at one point, my brain almost shut down because I didn't have enough oxygen that was circulating in my brain. That was because at one point, my value was just so low that I didn't have enough oxygen circulating in my brain. So my brain almost shut down, and I was really having what I term excruciating headaches. I couldn't sleep. It was really terrible. So imagine if I had just collapsed and died, somebody would have said, this lady that I saw a couple of days who was so strong, who was so fine, what must have happened? So if you are not aware, if you don't take these things seriously, be rest assured, you can one day realize that your life is cut short for something that is treatable. So what are the basic health information to be aware of? As I said, we were emphasizing just on the symptoms, the basics, and some of the basics are symptoms and the signs. For example, the common symptoms for iron deficiency anemia, the ones that I have highlighted, thick, are those that are really they're common with so many people. There are others that are there, but these ones that I've highlighted are the very, very common ones. extreme fatigue. You realize that you are just so very tired. You don't even know what you've done. You can just get up and realize that you're tired without even having worked anything. Headaches, as I said, for somebody who also have blood pressure, they also have headaches. Somebody like me who is suffering from both, I am now able to differentiate when I have headache, the one that is iron deficiency anemia, and the one that is headache, is blood pressure. When I have blood pressure, if my blood pressure is high. So know that some of these common signs or symptoms, as I said, fatigue, headaches, cold feet and hands. For example, places can be this hot, you just realize that your legs are cold, your hands are cold, your feet are cold. For some people, they look pale. For others, you're weak. As much as you're weak, their pulse is really rapid. Some people's breath, they breathe so rapidly. Others have heart-related symptoms. Some people have abnormal heart rhythms. Some people have dizziness. They can't really see well. Like for example, all of these symptoms, I'm going through all of them. I just find at times my vision is so blurred. I feel dizzy. And some people have enlarged hearts and heart failures. Some of these symptoms are when you are being diagnosed and the doctors can see more of these symptoms in somebody who is really, really anemic. The good news, as I said, is that anemia is often can be successfully treated and it can be prevented if it is diagnosed early and you have your treatment, then everything is going to fall in place and everything will be fine. Now, what are the major effects of iron deficiency anemia on our general health and on fertility? On general health, I've mentioned some. Adults and children, for example, children and infants are at risk of developing difficulties in cognitive and emotional and adaptive functions. Children have developmental problems, difficulties with their brain when they are anemic, when they are really suffering from iron deficiency anemia. At times, as adults, when we are not even able to, how can I put it? You find yourself maybe reading a novel or reading a book, you realize that you're reading a sentence 5, 6 times and you are not even getting it. Most of these things can be iron deficiency anemia, and it also happens with children. I know that some children really lack concentration when they are growing, but it is always good to know if a child is anemic. My daughter, for example, my first daughter, my first child, she's anemic. I could not believe that she was anemic, but when I was told, I was really in shock. Why? Because while we were in the US and I wanted to enroll her in school, one of the prerequisites for going to school in the US when we were in Minnesota at the time, I don't know if it is still the same, your child has to undergo medical examinations. And that was when she was diagnosed with iron deficiency anemia. And I was like, if this child can be suffering from iron deficiency anemia now, when she's still a baby, I imagine when she's going to be of reproductive age, how that will be. So, dear participants, it's really important to check even your children. Check them. Go to your doctors. It's very, very important. Some people also suffer hair loss due to anemia. And there are also studies that have documented delays in both language and motor development in children due to iron deficiency anemia. So these are some of the effects of iron deficiency anemia on adults and on children. And on fertility, pregnancy is associated with increased demand. Increased demand, therefore, increased iron, Pregnancy is associated with increased iron demand. Therefore, a lack of very low iron deficiency anemia will result to infertility or conception problems. That was my case, something I didn't even imagine. Iron deficiency anemia can also cause premature labor. and multiple miscarriages, especially during first trimester as a result of reduced or not enough iron to be able to carry a child. I went through that as well. I had a series of miscarriages, 2 months, 4 months, 3 months. And then on fertility as well, it affects maternal and fetal well-being and is linked to fetal death or low birth weight babies. Now, let's talk about treatment, control, and management. It depends on the cause and severity of the anemia. In the case of mild anemia, diet change is one, and it's a good option. Simple home remedies that include, it's really encouraging to get iron fortified food. For example, red meat, pork, poultry, seafood, beans, green leaves. When I talk of green leaves, like spinach, we can also eat things like cabbages, dried fruits such as raisins, apricot. The list is really long of things that can be eaten. It's also, and we are also encouraged to eat iron fortified cereals, bread, pastas, and iron supplements. I ate these things, but I needed extra iron supplements because I'm one of these women of reproductive age who has heavy menstrual flow. So I needed extra iron supplements. I even said that at one point, my life was at risk of iron deficiency anemia. And some people, even iron supplements is not enough. Some people even will be administered like pints of blood. At one point in my journey, I was administered 6 pints of blood because of iron deficiency anemia. So that is how serious this could be. So here, I wrote something in red there that if there was an identifiable cause, it's good to treat the cause. It's not just good to say you are treating iron deficiency anemia without knowing what is actually the cause. I'm more into prevention than cure. My journey, my specialty is I do more of prevention. I'm more interested in prevention, and I'm more interested in control than treatment. So normally I'll always advise people to prevent than to treat. Why? Because prevention is cheaper. Why? Treatment is expensive. In this case, when your anemia is identified, if it is what type of anemia and what is the cause or what are the causes of your anemia, it is always good to treat the causes of anemia. For example, I learned that in Cameroon, for example, when a woman is pregnant, one of the first things that they do is they test them for iron deficiency anemia. And it was one of the reasons why they test them is due to intestinal causes. I didn't know that. I just knew that, for example, like what my case was at the time and during when I was doing some of the studies on iron deficiency anemia, I had really not known of the intestinal causes of iron deficiency anemia. And that is very common in Cameroon. I won't say in Africa, because I also learned that due to mosquito bites and things like that. So I actually don't know how far that is true, but the doctors that I communicate with and the doctors that I ask some of these questions to, they also testify to that. So I don't know if some of you have had information on things like this or you've heard stories like this before. Now, what we just saw were symptoms of iron deficiency anemia, the treatment of iron deficiency anemia, what we could eat in order to avoid iron deficiency anemia. Now, I'll switch to blood pressure. Blood pressure or hypertension is also what I call a silent killer. And the only reason why I'm interested in hypertension is because during our sensitization campaigns, during our workshops, I remember that during one of my awareness campaigns, a participant died. She collapsed and died. And at the time, I didn't know that the patient was suffering from high blood pressure. The population was really overwhelming. There were just so many people who turned out. We started with anemia, and then when this lady died, and since we had doctors that were with us, and we realized that it was high blood pressure, that was not the only case. That was the only case that died, who died, but there were also other cases that we realized they were suffering from high blood pressure, and the values were really terrible. You could not imagine how they were living. They were like walking corpse. So that's how we decided to add iron deficiency anemia, high blood pressure into our program. Now, according to World Health Organization, blood pressure is the force exerted by circulating blood against the walls of the body's arteries, the major blood vessels in the body. Hypertension is when blood pressure is too high. That's the short definition of it. When your blood pressure is high, it means that you're hypertensive. And blood pressure is written in two numbers, the systolic and the diastolic. And the systolic numbers represent the pressure in blood vessels when the heart contracts, or when the heart beats. The second, which is the systolic value or the systolic number, represents the pressure in the vessels when the heart rests between beats. Hypertension is diagnosed when readings are consistently above 140 over above 90 over a period of time. We know that at times there are also studies, or we also learn that it's 120 on 80. It can also be 140 on 90. This when it is consistent over a period of time. Then this is when you are diagnosed with hypertension. When it is over the values that you just saw, 140, when it is over 140, above 90. So risk factors, there are modifiable risk factors and there are non-modifiable risk factors. And the modifiable risk factors include unhealthy diets. We all know what unhealthy diets are: excessive salt consumption, diet high in saturated fats. For example, this type of fats are found in cakes, sausages, low intake of fruits and vegetables, physical inactivity. When we are not physically inactive, we are at risk. Consumption of tobacco, alcohol. I know we are Christians here. We don't consume tobacco, alcohol, and being overweight or obese, risk factors. Non-modifiable include a family history of hypertension, for example, over the age of 60 years, and coexisting diseases such as diabetes or kidney failures or kidney disease. Hypertension is called a silent killer because, as I realized, many people are even suffering from hypertension and they don't even know that they are hypertensive. So when they find themselves collapsing and dying, that's when some people know, though some will interpret it as witchcraft. And as I said, our goal is for people not to think that everything is witchcraft. There are common diseases that will kill us when we don't take care of ourselves. Most people with hypertension are unaware, as I said, of the problem because it may have no warning signs or symptoms. For this reason, it is essential that blood pressure is measured regularly. When symptoms do occur, they include early morning headaches, nosebleeds, irregular heart rhythms, vision changes, buzzing in the ears. Severe hypertension can cause fatigue, nausea, vomiting, confusion, anxiety, chest pain, and more muscle tremors. So as we can see, some of these symptoms are common symptoms that we live with every day. But for some reason, we are stubborn to actually go to the doctor for confirmation, for tests, to know exactly what we are suffering from. So It is always advisable when you have symptoms, when you feel that your body is not right, when your body is communicating, please, it's good to act. It is good to act. Complications, chest pains, heart attacks, these things are common nowadays. Heart failures, irregular heartbeats, sudden deaths, as I said, irregular heartbeats can lead to sudden deaths. So hypertension can also cause stroke. These are diseases these are health issues that go together with other diseases. Like most of the time when you see somebody suffering from hypertension, you realize that either the person also has diabetes, and at one point the person is definitely going to have stroke. When you don't take your medications, when you don't do checkups, when you don't follow up, these things will take your life within minutes. In addition, hypertension can cause kidney damage, leading to kidney failures. A lot of people are suffering from all of these things today. Please, let's be aware. Please, let's go for regular checkups. It's really, really important. How can we prevent? How can we prevent and how can we manage? It's good to eat fruits, vegetables. It's good to be physically active. Be active on regular basis. When I say physically active, it doesn't mean that we must go to a gym, register and do sports all the time. It's good to walk. I'm sorry to say this, when I was in the US, I just realized that many people don't walk. It's not good to generalize, but I realized that a lot of people don't walk. I say it in my family. I will not talk on behalf of every other person, because it was like the car, like, can we just go there and get on they want to take the car. I'm like, you guys don't cycle. Oh no, what for? It makes life easy when you, please, let's be active. Some of these things we can avoid them by being physically active. We can walk. Walking every day is good sports. Let's avoid the use of tobacco. We on this platform might not be tobacco consumers, but we have family members who are tobacco consumers, or those who consume a lot of alcohol. We can reach out to them. We can explain some of these things to them. Let's try and limit our intake of foods with high saturated fats. Like, as I said, these saturated fats are found in things like sausages, cakes, for example. We should also eliminate or reduce trans fats in diet. Reducing and managing stress. We find ourselves in a society or in societies where there's a lot of stress. We have to learn to manage our stress. I know it's not easy, but it's doable. At one point when our bodies can't take it any longer, it's good, it's better to give a break, to take a break, to rest. It is very important. Some of the collapsing and dying, some of the sudden death where people just sit and don't wake up, it's due to a lot of stress. I know it's easy to say we should reduce stress. It's easy to say than done, but please, it's doable. It's doable. If we think that our health is important, if we think that we have children to take care of, there are just so many things we can consider as we live our lives. Please, let's make it a habit to regularly go for checkups, visit our general practitioners. It's very, very important. Let's treat high blood pressure. It is treated. We have medications that can help us. I don't want to conclude that people take medications and they get well, but I know that you take your medication to manage it, to control it. I don't know somebody who has taken high blood pressure medications and got well of it. I don't know. As to the best of my knowledge, I've been regular on my drugs and I've been living very well without any problems. But it doesn't mean that I'm really well. No, I'm managing it, because there are moments that it's high, there are moments that it gets low. It all depends. So It's also good to manage other medical conditions, because managing other medical conditions will help us prevent high blood pressure. Now, on this slide, we have blood pressure machines and Floradix. Floradix is the iron supplement which I use, and this is what I usually recommend, liquid iron supplements, because I have had cases, I've met a lot of people like myself who have had after effects of taking iron tablets due to constipation. Because iron tablets gave me a lot of constipation, I was advised to go in for iron liquid supplements. And I realized that with iron liquid supplements, there was actually no side effects. It was really out of natural plants, this particular one, and it really had no problems. So usually during our campaigns with our medical professionals, this is what we give to our participants or our patients, because we give them to patients for free. That was before, but now we sell them. So we also make sure that we distribute our blood pressure machines in order to help our communities. Some people can't afford them, so we give them. I remember that during one of our campaigns, the goal was to distribute these blood pressure machines to everybody. But the turnout was so overwhelming that we couldn't even, not everybody could have a blood pressure machine. So what we did was, in their small prayer groups, in small church groups, small community groups, we made sure that we gave to each group blood pressure machines. And to those who had alarming high blood pressure values, we made sure that we gave them as well. So that for the groups, as they meet every time, the prayer groups, as they meet once in a week or twice in a week, depending on how regular they meet, some could measure their blood pressure, and it could be like a regular measurement thing, so they know if they're hypertensive or not. And those who finally discover that they were hypertensive, they'll go to the doctors, because the doctors know exactly what kind of blood pressure medication that they prescribe to these patients, because not all high blood pressure medications work with everybody. Now, Floradix is also what we give. But in Cameroon, as I learned, iron supplements are distributed to pregnant women for free, even though midwives that I work with in Cameroon, they have been complaining that there is a lot of mothers dying during childbirth, because many of them are anemic. Really, many of them are anemic. So I asked myself, how come is it that they are being distributed free iron supplements, and then at the same time, a lot of them are still very anemic? So I just wanted to show to you some of the things that we give, like these are the iron supplements, and then the blood pressure machines that we give during our campaigns. And during these campaigns as well, while we distribute these supplements and blood pressure machines, we also encourage routine checkups for early detection and treatment, which would significantly improve quality of life and well-being. We also as well suggest that measuring hemoglobin levels, that is in the case of iron deficiency anemia, measuring hemoglobin levels be included in routine examinations. That's basically some of the things we do during these campaigns as well. We also partner, HIT is Health Improvement Initiative. So we also partner with doctors, both in the diaspora and in Africa, as I said, and heads of organizations with common goals to collaborate in order to enhance awareness. And examples of these doctors that we collaborate with, it's like Doctors Health Initiative. This is in Nigeria, because we do projects not only in Cameroon, we do projects in Africa. We've been to Nigeria. Because of the coronavirus, that's why we had to postpone our trip for Kenya and our trip for Tanzania. We postponed our trips there due to iron deficiency, due to the coronavirus. That's been ongoing for the past 2 years now. So we also work in collaboration with churches, like here in Germany, the church with which we collaborate is Christ Gospel City, and we do organize workshops. We have doctors there as well. When we join, we talk about these health issues for men and women and children as well. We also partner with organizations, government leaders in both African and European countries to encourage and fund such initiatives. I'm a regular speaker at the Global Health Catalyst in Boston, that's in Harvard, where I usually showcase the projects that we do in Africa. So each time we do projects on iron deficiency, anemia, high blood pressure, and all of this, and other projects that we do, like now that there's war going on and other things. So we just said, we can't just, now people need more than only hearing about health. Some people need to eat. We need to empower people economically as well. So when we do these projects, I'm a regular guest there, a regular speaker. So I showcase all these things that we do and how we try to solve these problems, because it is not only good to talk, it is good to also bring solutions on the table. So this is actually the things that we do through health improvement initiative when we are on the ground, trying to create awareness and to sensitize our communities. We are also available and ready to work to partner with other organizations in different communities. Why not DML as well? You never know, we are ready to also partner with you guys to work as a team. So these are some of the pictures, like during campaigns in Nigeria, in Germany, where we do our outreaches. We distribute supplements. We talk about high blood pressure. Our workshops where we talk about mental health and all of those things. Here are some testimonies of people we've worked with or people who've gone through our campaigns, our sensitization programs, our awareness programs. These are some of the testimonies we've had. I just decided to take a few. I didn't want to fill the whole place with testimonies here. So this is a testimony from one of our sisters who is in the US, in Houston. Today, I look back in the journey I went through before I had my son, and I can't thank God enough for using you, my friend, to bring forth this miracle. If not for your advice with the blood tonic, I would not know what would have happened. Please continue to help others out there and God will reward you greatly. So she was not able to conceive. She had been suffering from iron deficiency anemia. She was unaware, as ignorant as I was. And until I talked about the blood tonic and iron deficiency anemia and actually encouraged her to go for a blood test. And when she came back, and I advised her to take this blood tonic. And that was actually what helped her. That was her case. I'm not saying that that is the case for everybody, but when it is iron deficiency anemia, it is good to take your blood tonic because it's definitely going to help you if that is your problem. Then this is another person, another sister who sent in her testimony from Kuwait. This is a big shout out to say thank you for the Floradix and a Floradix plus help. Floradix iron plus help. It has totally transformed my immune system. After consulting with you, I haven't finished one bottle yet, but my energy level now is just amazing. No more dizziness, no more headache, and all that. You are a lifesaver. I'm grateful. God bless you. And the last one that I wanted to share with you as well is I want to thank you and your organization for the blood pressure machine you donated. It has been of great benefit. I've been able to monitor my blood pressure, and now it is under control. This is a brother who sent us his testimony from Cameroon. There were just so many testimonies, and I decided to share just these 3. There is a lot of information. This was just a short presentation to create awareness that despite the fact that we are in the diaspora, it doesn't mean that we are aware, despite the fact that we have all the means of being informed, of getting information. Some people still are not aware of the fact that they are anemic, they are iron deficient. Some people still didn't know or are still not aware that they are hypertensive. Please, my story was just a summary, a sneak peek of what I went through. I just summarized. It's a journey. There's just so much information that is beneficial. That's going to be beneficial to a lot of people. It might not be you. It might be a sister. It might be a brother. It might be a cousin, a relative, or anybody. This is my book, From Pain to Purpose, my fight with iron deficiency, anemia, infertility, and finding God's grace. It is on all Amazon platforms, and there is just a lot of information that you can feed on. There are just so many teachings, how God kept me going, how the Holy Spirit didn't stop administering to me, and how I really fulfilled my purpose on earth, as I will put it, because I did public health. I work as a public health specialist, but I have dedicated most of my energy to impact other people's lives, to put smiles on the face of other people. So most of our projects are carried out in Africa. We do workshops here just for some of our brothers and sisters in the diaspora who might not also know. So in the diaspora, we focus more of our energy on mental health. We also do mental health in Africa, but in the diaspora, it's more on mental health because a lot of people are dealing with mental health issues with stress. So I mentioned all of this in my book, how the whole iron deficiency thing affected me, the stress I went through, the depression, how my mental health, the support I had, and how I am manifesting my calling just by obeying to the word. So as I said, it will be a pleasure if you grab your copy to bless someone, not necessarily you if you don't need it. And it's found in all Amazon platforms. I want to acknowledge Dr. Emmeline B. and the DML team for this special opportunity given me to share my experience. It's really been a blessing. I feel blessed and honored when I'm able to bless people with my experience, because I have had people come back to me and thank me for just little information. And I said, it is God's doing, it is not me. So I just want to thank Dr. Emmeline for this platform and for the opportunity. And I also want to thank any other person, other participants who tuned in from all over the world, from everywhere, those who were invited, who are not part of the team. I want to thank you very much for your kind attention, and thank you for listening. For more information, you can visit our website. You can check my social media handles under the following, as mentioned on the following, under the slide, on Facebook and on Instagram. So for more information, if you check me on Instagram, you'll get more information on different types of anemia. They are all, I do that on Instagram and then on Facebook as well. Thank you very much. And if there are any questions, I would like to answer those that I'm able to, and those that I'm not able to, I will meet my other specialists as well, because I also work with specialists in the clinical domain, like how do you say, gynecologists I just want to apologize if you see me think before talk at times, is because at times it's German that is coming and I have to pause and think first and speak in English. Thank you very much, and I'm ready to answer your questions.
Wow. This is just wow. I don't know how many times I almost collapsed on the road or driving. I know the people from DML, they'll bear me witness. So all of 2019, I was in the hospital, in and out, because I had headaches. I thought it was the screen that I was looking at. I thought it was a noise in church, Pentecostal church, the drums. And then all of that stopped. I finished school and I'm still having headaches until I read your book on a fateful Sunday afternoon that God sent me home because of rain. And now and again you are talking and I'm thinking that even the ringing in my ear that is still there is probably hypertension. And I need to deal with that. But thank you so much. We have a lot of time. We still have some time though. So if there are questions, you have comments, can we, Mark, can you stop sharing? That way we can see everybody's face as well. So if you have any questions, if you have any comments you want to make, I have a question. Is there a connection between iron deficiency and blood group types? That's from Sister Quinta. Yes, so if there are other questions, feel free to come on and ask. I see Jesse putting up his hand. So when she answers the one from Quinta, they will come to you. Okay.
The question is that, is there any
connection between
iron deficiency, anemia, and blood? No, to the best of my knowledge, there's no connection between iron deficiency, anemia, and blood type and blood group types. I know that there is sickle cell anemia, and it has nothing to do with blood group, with the types with our blood group types. As I said, anemia as a whole is a disease, and if we don't eat properly, we can have anemia. Some people, anemia can be genetic as well, and it has nothing to do with blood groups. For example, my daughter was diagnosed with iron deficiency anemia. She got that from me. I had been iron deficient, I had been anemic for a long time without knowing, as I said. It had nothing to do with my blood group. I'm AA+. It had nothing to do with my blood group. It's just because as a woman of reproductive age, I had been losing a lot of iron through heavy menstrual flow. And I had not been replenishing the iron that I was losing. And I was having all these headaches, lack of concentration, the dizziness and everything, and my brain almost shutting down, excruciating headaches because I was losing iron. Our systems also produce iron. But as I said, there are different types of anemia. I really don't want to go into these clinical things because I'm not really best in explaining the clinicals. My area of specialty is prevention and control. Prevention than treatment. But at least I will share with you what I know. Our systems produce red blood cells, but some people don't produce red blood cells. Some people's systems don't produce red blood cells. So for that reason, they need to take vitamin B. When you take vitamin B12, there are some that you need to also inject, because when some people's body don't absorb, they don't absorb. And when you have iron, usually I always advise people, when you are anemic and you are taking iron supplement, it is very, very good. It is advisable to take vitamin C, because vitamin C is going to help you absorb the iron that you take, the iron intake. Because when the iron is not absorbed, you will still look anemic because it's not working in your system. So it's always good to take vitamin C when you are anemic and you are on iron supplements. It helps absorb the iron in your system. So to the best of my knowledge, iron deficiency, anemia, or anemia has no connection with your blood group.
Thank you. Jesse and Giadi, they have their hand up first, so Next, they are up next. I just took my vitamin C. I took iron this morning and I haven't taken my vitamin C. So
Okay. So let me go with first
yes,
with
Jesse.
man. Oh, sorry.
Jesse.
Yeah.
Yes, thank you for the presentation. We like the information. And yes, I want to comment, we have to go for our checkups to get our mechanic changed and check our garage. Prevention is much better. I
Absolutely.
have a question about your groups, your health groups in the churches. Like, how did you put those, how did you organize them? How did you recruit for the church groups? And working with pastors, working with churches to get those groups together to encourage people to come to them. Because as you state, people have a lot of their own beliefs about healthcare, and they don't believe anything many times that a doctor tells. They'll continue to ask or to continue to believe their own communities. So what were the ways and tactics that you recruited in the churches?
Okay. Thank you for your question. That's really a very important question. How do I do to recruit in the church? How do we encourage people in the church to attend our workshops? If I got your question very well, because it's breaking, so I was really straining to understand what you're saying. So if I got your question very well, is how do we engage people in the church to participate in our workshops or during our campaigns? Is that your question?
Yes.
Okay. As I said, for example, I'm in a Pentecostal church here. I attend a Pentecostal church here. Usually I always start with, I'm active in the women's group, for example. I'm active in the women's group. So this is what I did. One day, I took a couple of women. The strategies are different in different groups. I just want to tell you how I started in my own group in church. It was just like one good day after church service, the message was really touching. And for some reason, I'm a very private person, but for some reason, after that message in church, like God laid it in my heart, was like, you have to share your story. You have to share your story because there are people who need to hear it. The way I presented my story here on these slides is quite different from the way it is in my book. So in my book, it's really detailed. So I decided to now share my story from the message I got in church that day. It wasn't like I was invited to talk. I was just like, sister, there is something I just want to share with you. A lot of women are suffering through this. Like I started with infertility because I know it's a very sensible topic, and a lot of women are going through it. Many will not talk, many will not open up, but I just thought that was a nice way of starting, of opening up. So when I shared my story to these women, lo and behold, I didn't know that the people I was sharing this story to, there were just about 3 women after church service. I walked up to them, greeted them. We've been friendly all the time. But for some reason, I just said there was something that is in my heart. It was preached in church, but I'll give you a little bit more detail. The preaching didn't have to do with me, but it had to do with a situation. And I want to share it with you guys. Maybe you will bless somebody. That's how I started. Just like a joke, I shared my story to them. I didn't know I was directly talking. In fact, these were people who needed to really hear me talk. So when I shared my story to them, and that was just how it started. And in our church, in the women's group, we have a committee. One of these ladies invited us, sent us a letter in the committee and said that she wanted us to talk about health. If some of us in the health profession, we could really talk to the women because she's going through a lot. And I shared an experience with her, and she believes that there are many more people in church. That was just how it started. And when she said that, I walked up to the pastor, and we among the women, we had discussed and said during our monthly meetings that we want to include a talk in our program And we hope that if everything is successful, that's how we are going to be doing it all the time. And why not to the whole church as well? So we started in our women's group. That's how I shared my experience, what happened. Women came. I said, I started with a very sensitive topic, this pregnancy, childbearing thing. And many people were interested. Some ladies who were there, it was not necessarily because they needed children or they were praying for the fruit of the womb. No, they knew others. They knew somebody, and this somebody knew another, and this other. It was just a chain reaction. So that's how we started. And women turned up. And from one topic, we went to the other. And each time we go, what I do is I make questionnaires. Like, when last were you at the doctor? Do you know your health status? Do you know your BP values? Do you know this? I put some of these questions. And during our talks or during our meetings, I distribute them and I expect them to fill and hand it back to me so I can get the statistics. And that was how it started. And we were able to encourage women like that. So everywhere I start with my story. I know we are all busy people here, and I really didn't want to go into details and everything. If not, we'll stay on this platform. From the way I presented that story, it actually motivated a lot of women. And then we have some health specialists as well in our church. So one lady, like the gynecologist, will really talk about more, will give some more details. The surgeon will have his own thing to talk about. Mental health special, that was just how it is. And we did like that to mobilize people. And then it didn't end only in our own group. Another person talked about it in another group, and the interest was, that's just how it is. And that's how it was. And it just became so viral. And we were able to really do this church, speaking in other churches. And then I remember I was also able to mobilize in other church communities out of Germany, because during one of my presentations in Harvard, there is one lady, this YouTuber. I don't know if any of you might know her. They call her Adiola, Keeping It Real with Adiola. So I was one of the speakers in Harvard, I think it's 2018 or so. Yeah, no, 2019. In 2018, we were all speakers, but we didn't have the opportunity to talk. So to talk after I did my presentation. So in 2019, we were both speakers again in Harvard. And after my presentation, she came up to me and she asked me if it would be okay for me to share my story, if she could make a documentary on my story, because it is a topic that was really going to help a lot of women. I said, it's not a problem. And when she did that thing, that whole show thing, I was shocked. The people who reached out to me and the invitations that I got from church leaders in Austria, other areas. So that was just how they think. I'm surprised how people were so interested, and that's how God did it. No special way, I just shared my story. People were interested, and that's how it went. And that's how we've been able. And then in Cameroon, for example, some of the people with whom I collaborate with, like the volunteers, they are also Christians, really devoted Christians, and they know it and they talk in their churches. And I think last year I was in Cameroon, where I had a workshop or a seminar in church, where he had mobilized people. He brought people and they were there and they were really able to come in their numbers, and we spoke. So it's just that I'm also very kind of picky when it comes to the people with whom I want to collaborate. I like to work a lot with God's people. So we share the message and how God uses others. So that's how the message went through.
Thank you.
I don't know if I've answered your question, but that's how I was able to mobilize church groups.
Thank you. I think we got it's through sharing your story, word of mouth, as friends gear, and they share it with others send invitations and things like that.
Absolutely.
Uncle Freeman, your hand was up. I don't know if you still have a question.
No, let me first go. There's somebody whose hands has been up for a long time, and that's Joy.
Max, I'm seeing them as their hands came up and went down. Yes.
Okay.
So
Okay.
Freeman and then Joy.
Okay. Thank you. I actually want to thank our presenter for this wonderful presentation. In my own case, I think one of the reasons why I've been shying away from checkups is that for the past 20 years or so, I've been to many hospitals. I've seen different doctors, and I'm still trusting God for that healing. But I want to say that from the presentation, I have a little more hope that, and then knowledge and application of knowledge is power. So there are things I've not been doing before that I'll be doing now. But I want to ask, what's the place of high blood pressure with dizziness? Before, it's as if someone has a BP, I used to feel maybe it's a stigma. It's just like saying that this person has HIV and AIDS or so. In my own case, early last year, I had an experience I never had before. And from that moment, I was hospitalized and I was home for 1 month. And from that time till date, from time to time, I feel dizzy. Sometimes as if I should just fall. So will that be blood pressure related? So that's my question. Thank you.
Okay. Dizziness is one of the symptoms of high blood pressure. Dizziness can also come through, like when you have a blurred vision. One common symptom of high blood pressure, one common symptom is when your vision is blurred, when you are dizzy. And it is easy to know, like I said, for example, in my case, I have been so informed, I've really known my body, how it functions, so much so that I'm even able to distinguish when my headache or my dizziness is the blood pressure one, or it is the anemic one. And how do I know? If I get up in the morning, for example, because I know that every end of the month after my period, because I know the kind of period I have, I make sure that I take my supplements. I make sure that I take my vitamin C. And without anything disturbing me, knowing very well that I'm already a blood pressure person, a high blood pressure patient. When I get up from the morning, when I get up in the morning and I realize that my eyes, normally when you just get up in the morning, for example, you don't just see immediately, it takes some time. I always advise people, when you are getting up in the morning, you don't just get up with speed. Some people just get up so fast. It's not good to get up that way. It can really affect your system, especially when you are somebody who is hypertensive. When it's in the morning and you've been sleeping and you want to get up, you can just lie for some time, open your eyes, and then before you get up gently, don't just wake up like that. I don't even know how to explain it. Don't just get up with speed. It's not good. You don't do that. And because you can just even try to do that and you collapse, and that will be all for you. For somebody who is hypertensive, you don't do that. So this blood vision thing has to do with, as I said, anemia, blood pressure. But for men, I'm not saying that men don't have anemia, but I don't think yours is going to be anemia. It's going to be hypertensive, because for people who have anemia, men, as a result of maybe other diseases like kidney and all of those other medical conditions that they have, cancer, that makes some men have this anemia. So for most of the part, most often, if you are having this dizziness, please check your high blood pressure. It might be that your blood pressure is high, more than the normal value that you have, and you will be feeling dizzy. And for some people, they will not really see well. The vision is blurred. These are just normal symptoms of high blood pressure. It is like that. Your blood, the pumping of the blood is very fast than the normal rhythm that the blood is supposed to be pumping. So stress will also help you. Lack of stress, managing your stress will help you calm down. Then this dizziness thing will also calm down. So I think that your dizziness is high blood pressure. And please confirm some of these things with your medical practitioners, like this high blood thing. It is really good to control it. And at times, as I said, there are modifiable risk factors, and there are non-modifiable. Some come with age. Normally, high blood pressure most often should be a disease of the age. That when you are getting old, then you can have this high blood pressure from the 65 years and above. But because of the society, because of the things that we've involved ourselves in, because of the condition, the situation, the stress and anything, and in fact, the environment, it has just happened in such a way that young people who are, in fact, children are even having blood pressure. My daughter, for example, I always like to give example around my people that I know, because I don't like to generalize. My daughter, for example, she's really suffering from nose bleeding regularly. As I said, she's anemic. I've been to doctors, I've been to specialists, because I want to understand why she is having anemia. As for myself, my own cause, I already know what my cause is. As from her, it's been one of the causes, as the doctors told me, is genetic. She got it from me. And now she has this nose bleeding all the time. And the rate at which the nose bleedings come, there is high blood pressure. And that was one of the causes, one of the symptoms that I said, nose bleeding. Even in school of recent, her nose bleeding was so much that even when they measured her BP was really high. I was shocked. She's just 11. When she has this nose bleeding, the BP is high. And this is something that I'm trying to put on to control as much as I can. But at the same time, I'm trusting God for complete healing. That was one of the reasons that I mentioned from the beginning, that the church as a whole can help. Because some people think that they just need to only pray, pastor just needs to lay hands, and that is all. No, church will pray, pastor will lay hands, but then do your own part. Don't just sit and don't act. Do your own. So my brother, please go and check up. And if you check up and it is high blood pressure, which I think it can be high blood pressure, you can be put on medication depending on your value, on your diastolic and your systolic values. You can be put on medication, and it depends. This one, only a general practitioner will tell you what kind of medication you will be put under, because there are different types of medication for different levels of blood pressure.
Thank you.
Yeah.
Joy?
Okay, thank you very much. I will not put
You're
on my
sharing
video
your
because, pardon?
Somebody is sharing the screen.
No.
But Danla, you're sharing your screen. I think you made an error. Go ahead, Joy. Sorry about that.
Okay. Well, Sister Marceline, thank you so much for this presentation. Even when I listened to your video and the one-to-one I had with you, this one has come to add more. I want to appreciate, because I'm one of those people who is afraid to go to the hospital because of some challenges that I had as a result of going to the hospital. I had a surgery that they did some stuff with anesthesia, I almost died. And then some of those things like that have kept me away from the hospital. But when I got to know about you and listen to your video, it actually encouraged me, because I usually have this dizziness, headaches, this fatigue that I take even time to rest. They say it's too much work. I will rest for 1 week, thinking that I've rested, but I'm not able to make it. I'm still very tired. So when we started talking, I went through some other tests, which I'm still waiting for other results in the next 2 weeks. That's when I realized that most of the things that I've been doing have intoxicated my system. When I hear that this person is taking this supplement, I just drop and I take it because this person shared this symptom. I think that that symptom looks like my own, but we are not sharing the same challenge. So I really appreciate that we started this relationship, But what I would like to ask from you is that, how do I help people who live in rural communities? Because I actually have a bigger audience. When I was working, I was in the North 2 weeks ago, and I was sharing with some women who, you know, in the northern communities, when you get married and you don't have children, it's really a serious challenge. Some of them that I was talking to, they really actually needed help. But I don't know how we could get medical practitioners. How do we mobilize people in communities like this who cannot access, like we are having this online? How can we help people? With your experience of organizing workshops, how were you able to help people in areas like this? Because I think sharing my story, like you said, you share your testimony. I actually opened up and I talked to them about, I said, I've been married for 4 years. I've not yet had children. It's not like I don't like having children. I'm excited. My failures, I shared my challenges, my pain. And I see that there are a lot of people around me who share the same pain. There are people that I thought that they were very strong. But in the course of opening up, I even shared during a conference, and I have this whole lot of women. But the challenge we have is that they cannot access internet. How can we come about bringing them together and giving them the help that they need in this domain?
Joy, thank you so much for your question. It's really heartbreaking to know that you work a lot like in rural communities, and then it's kind of challenging to bring maybe women together to be able to help them. Now, what I'm going to tell you is that most of my sensitization and awareness projects that I do, most of it has been in the rural communities. And as I was saying, the turnout was really usually overwhelming. I don't know, because maybe it's an issue of culture, because most of these campaigns that I've done so far are English speaking. And then you are in the north there where they speak French. Most of the people, I don't know if, I know that there are English speaking people in the north as well. It was kind of easier for me because, as I said, I went through church as usual. It happens that some of my volunteers, when I reached out to them, and that this was my plan, and this is what I intended to do, they started the work on the ground before I even bought my flight to come to Cameroon. What they did, for example, they made flyers, they made radio announcements. They were in churches, elders in churches, they met them, they spoke with them, and how serious and important it was that they needed to get the information, they needed to hear it. And they were motivated. As I said, I was shocked. The population was so overwhelming that I thought I had really done wonderful thing. A number of blood pressure machines that I carried, everybody was going to go with his or her own. But my dear, I was shocked. It was not, I ended up giving group, until just for those very serious cases that they had theirs as individuals. So what I will advise is that I don't know how the churches there work, but I should believe that there are Anglophone churches there as well. We are not addressing only Anglophones. Maybe through the Anglophone communities, we'll be able to bring our Francophone brothers and sisters closer to us and share it with them. I started through church. I just knew that church for me was the right place to go in the rural community, to start there. And that was how I started. In church, the elders of the church, my volunteers on the ground. I don't know how many people work with you, but if you talk with them, that's how they will bring the people together. I trust you when it comes to groundwork. It's just that you can't do it alone, but you just need to know the people with whom you work. Visit churches. Maybe in our own side, the people were very understanding and they got moved. Maybe the mentality that way is different. The mindset that way is different. I don't know, but it was easier because I went through the church to get people in the rural communities and in Jangi houses, the meeting houses.
Okay.
Thank you.
Okay, Okay, actually, what I really, for mobilization, I don't have a challenge. For what we need to do, I was finding out was that, can we get like a training of trainers once you could come back to train a team so that they should bring the information to the different communities? That's what we actually, mobilization, it's not a challenge for us.
Then that would be great. For me, it's not been hard on my part, because as I said, I choose even specialists in different areas that I'm working with, so that when I meet some complicated things, the people who are specialized on that are there to handle it. So I don't usually, in Cameroon, like as I said, I have nurses that are there. I have a public health specialist that is based in Cameroon, that he has worked even with HIV and all of those things. So I have different, like the other woman in Mutengene, she's the president of midwives in the Southwest region, for example. So I know that there are different special areas. I have specialists who deal with that. So it is easier for us to come and maybe train people who give this information. It is not difficult to do that. I will be in Cameroon by God's grace next year, and then we'll talk about that. Or behind the scene, we can talk about it.
Yep.
Yeah, we can talk about it. In Kenya, for example, when we're preparing to go to Kenya, for example, I already have somebody here who was already making arrangements with nurses already in Kenya, for example. I had somebody already here. Before I went to Nigeria, my partner here had already made arrangements with the Doctors' Health Initiative. And Doctors' Health Initiative is a group of doctors and nurses. It's an organization of doctors and nurses. So it was easier for me.
Okay, thank you again so much, Max. For if you want her to come speak to your network, you have her email address. Can you just put that again? I don't know if you can share that again or in the chat so people can copy it out. If there's not, take a picture then.
Sorry,
so that she's available. She's on Facebook. She's on, I don't know if she's sharing her WhatsApp number.
No, yeah, I share my WhatsApp number.
Okay, but she is available, and I'll put her contact again to you in the messages. So thank you again so much. So unless you have a question that relates to the topic, if it's about organization, for what happens next steps, please talk to her personally. But if you have any questions on health, on the contents that we have shared, feel free to ask. If not, remember we have another meeting again. So I want to thank you all again. And Max, I want to thank you so much for the information and for the enlightenment that you have brought to us today.
Thank you very much, Marceline. Let me just say one thing. And for somebody who was not able to get the handles here or information or telephone number, in fact, or anything, they can get it maybe through you. Yeah, that's fine. Yeah. If they didn't get it, because I'm not sharing my screen any longer, so they will not be able to see.
Oh, okay.
Yeah, because I'm also doing one-on-one with people who don't want to talk openly. There are some wives who I don't want to talk only to them. I talk with their husbands as well, because childbirth has nothing to do only with women. It also has to do with men.
Yeah, I was hoping you copy it and paste it in the chat. I closed the...
Okay,
yes.
Let me do that. Now.
So, but I'll hand over to Dr. Renita right now. And yes, for her to conclude our time together.